Okay, good morning, everyone. Thanks so much for joining us today for our talk titled After the Baby, Gaining You Back. I'm Dr. Christina Buchanan, and I'm one of the OBGYNs at St. Jude. And I'm giving this talk today with Dr. Pamela Estrada, and she's also an OBGYN at St. Jude. I'll be giving the first part of the talk, and then Dr. Estrada will wrap it up for the second half of the talk. So our objectives today are to describe how the body changes with pregnancy, review potential long-term complications from pregnancy and delivery, and to discuss different treatment options available. Now, our goal really isn't to scare you guys with all the potential complications that can happen from pregnancy and delivery, but we really hope this talk will shed light on some of the issues that maybe some of you might be currently experiencing or may experience in the future, so that you can feel empowered to talk with your providers about these issues and seek treatments that could potentially improve your quality of lives. So the body adapts to pregnancy, which is great because this allows it to accommodate a growing baby and then deliver it without causing too much damage. On average, women will gain about 25 to 35 pounds during pregnancy. There will be a shift in the center of gravity so that posture and body mechanics are affected. For example, there will be excessive curvature of the spine and changes in the pattern of walking. Hormone shifts cause joint laxity or looseness. And one of the joints that loosens is the pubic symphysis, which is the joint between the pubic bones. And this is beneficial because it allows the pelvis to widen in preparation for passage of the baby. During pregnancy, there's also increased pressure of the enlarged uterus on the pelvic floor. And the pelvic floor muscles are shown here in this picture. They span the bottom of the pelvis and support the pelvic organs, such as the bowel, the bladder, the vagina, and the uterus. And this will be important to keep in mind later on when we talk about problems that can happen from pregnancy and delivery. In pregnancy, there's also changes to hair, skin, and nails, as well as changes to many other major organ systems that we can't see. And while most of these changes are adaptive and very helpful for pregnancy, you can see how some of these changes, like changes in posture, looseness of joints, increased pressure on joints from the weight of the pregnancy, can predispose to muscle strain and lead to pain during and after pregnancy. The body undergoes even more changes during labor and delivery, which can cause damage to the muscles, ligaments, and nerves of the pelvic floor. With the vaginal delivery, there can be injury to tissues surrounding the vagina and rectum. And with the C-section, there's cutting through various tissues and nerves in the abdominal wall, which can take time to heal. In medicine, the postpartum period is typically defined as 6 to 8 weeks following delivery. During this time, the uterus returns to its pre-pregnant size. The lochia, or the vaginal discharge and bleeding, has typically ceased by this time period. The abdominal wall typically regains most of its muscle tone. Lacerations and incisions have healed and sutures have reabsorbed. During this time, most women will also have their final postpartum visit, during which they'll have an examination to address any remaining concerns, and then they'll be cleared to resume their normal activities, including sex and exercise. But although much of the changes of pregnancy have resolved by this time period, some women will still continue to have persistent problems postpartum. So this is a list of complications we're going to talk about in a little bit more detail today. And we're going to focus more on long-term complications, meaning complications that persist outside of the typical 6 to 8 week postpartum period. So low back pain, hip pain, and pubic bone pain are common during pregnancy because of the musculoskeletal changes that I talked about earlier. The majority of women will recover spontaneously within the first 3 months after delivery, but some studies have shown that as high as 30% of women will still report pain after this period. Hand or wrist pain is also common postpartum, and this typically presents as pain in the wrist near the thumb. It's usually caused by or exacerbated by lifting a newborn infant. So there are different interventions that can help with these problems, and I've listed them here on the slide. I'm not going to go into each of them in depth, but the point is that these problems are quite common and there are treatments available. So your healthcare provider should be able to point you in the right direction. The rectus abdominal muscles stretch and spread during pregnancy, and they usually return back to normal within the 6 to 8 week postpartum period. But in some individuals, they can remain separated by an abnormally large distance. This is called a rectus abdominis diastasis, and it results in an abdominal bulge or ridge as the rectus muscles contract with certain movements, like with sitting up. So that's shown in the picture to the right here. Now, this is different from a hernia because there's still a layer of tissue underneath the muscles called the fascia that prevents any abdominal contents from protruding through and being strangulated. So it's not dangerous to have this, and there's nothing wrong with having this, but to some women, it might be bothersome cosmetically. And so there are some things that can be tried to help this. So some studies have suggested that postpartum exercises can help with this. These exercises are typically focused at strengthening the deep abdominal muscles on the sides of the abdomen. So it's thought that activation of these side muscles can help to pull everything inwards and shorten that gap in between. Physical therapy can also help. And if conservative treatments don't work, surgery is also an option if there are no plans for future pregnancy. Another problem that can happen is perineal pain and pain with intercourse. So the perineum is this tissue that's shown here in the picture below the vaginal opening. According to some studies, up to 67% of women have pain with sex within the first 2 to 3 months postpartum. 20% of women report pain with intercourse at 6 months after delivery, and 8% of women report persistent perineal pain at 1 year following vaginal delivery. Things that contribute to this are trauma or injury to this area during delivery, as well as low estrogen levels, especially while breastfeeding. Low estrogen levels postpartum cause a decrease in vaginal secretions, causing vaginal dryness and thinning of the vaginal tissue. So the effects are similar to what you would see in someone who has gone through menopause. So as you can imagine, these things can lead to pain during intercourse. If the pain during sex is due to vaginal dryness, you can do things like vaginal lubricants during sex, or vaginal moisturizers can be applied daily or a few times per week. Vaginal estrogen can be given as creams, suppositories, or rings, and can improve vaginal dryness as well as strengthen the integrity of the vaginal tissue. Pelvic floor physical therapy can also be extremely helpful for this type of pain. And we have a really amazing pelvic floor physical therapy program here at St. Jude, which I'm sure you'll hear about in some of the other talks today. So I would really urge you to see your OBGYN if you're experiencing this type of pain, and they can give you a referral to the pelvic floor physical therapy program. Perineal revision or surgical revision is also an option. However, this is usually reserved for women who have persistent severe symptoms, because repeat surgery sometimes can actually lead to increased scarring and pain. Sexual dysfunction, or in other words, having trouble wanting or enjoying sex, is also very common after having a child. And there are a lot of contributing factors to this, such as perineal trauma and vaginal dryness, like I mentioned earlier. Low libido or low sex drive can be due to different hormone changes postpartum, fatigue, time constraints, and stress. And postpartum depression can also affect sexual function. Because there are so many different underlying causes to sexual dysfunction, the first step really should be to see your OBGYN, and that way they can evaluate you to determine the most appropriate treatment option available. So now I'm going to turn this over to Dr. Estrada for the second half of the talk.
All right. Thanks, Dr. Buchanan, for that portion of the talk. I'll go ahead and jump right in here. Again, I'm Dr. Estrada. So pelvic organ prolapse, this includes another one of the complications that can arise after pregnancy. So the pelvic organs include the vagina, the uterus, the bladder, the urethra, and the rectum. And so these organs are actually held in place by muscles of the pelvic floor. Layers of connective tissue also give support. Pelvic pelvic organ prolapse occurs when tissue and the muscles can no longer support the pelvic organs and they drop down. And so the main cause of pelvic organ prolapse is pregnancy and childbirth, vaginal childbirth, which can actually weaken the muscles of the pelvic floor. Other causes include menopause, aging, repeated heavy lifting, or conditions that create pressure on the abdomen. So pelvic organ prolapse can actually occur at any age, but most women who develop symptoms do so after menopause. For those who do have pelvic organ prolapse, actually most of the people don't even have any symptoms and they don't even know. So mild symptoms include feeling a bulge inside the vagina, feeling pelvic pressure or fullness, leaking of urine, difficulty completely emptying the bladder, problems with bowel movements, and even lower back pain. So it's really important that these symptoms are brought up to your provider if you have any of them, because proper diagnosis is key to actually treating these pelvic support problems. Oftentimes, if these symptoms are not bothersome, you actually do not need treatment. This is not a dangerous situation. However, if they are bothersome, then it's really important to bring that up with your OBGYN provider so that we can talk about things to address these issues, such as changes in diet and lifestyle, bladder training, sometimes even weight loss or pelvic floor exercises, and then possibly even surgical management. Aside from the pelvic organ prolapse, there are also other pelvic floor disorders that can occur when tissues and muscles that support the urethra, bladder, uterus, or rectum are damaged, and that includes urinary incontinence. So that's the leaking of urine. There are actually different types of urinary incontinence, but one of the more common ones is stress urinary incontinence. And that's when there's a leaking of urine with physical activity such as coughing, laughing, or sneezing. And then for most women, these symptoms likely resolve after pregnancy, and the severity of these symptoms actually decline over time. Some of the things that we actually talk to our patients about are lifestyle changes, such as drinking less fluid, limiting caffeine intake, stopping smoking. Sometimes weight loss can help as well because of that decreased intra-abdominal pressure on our bladders. And then these can also help decrease the number of times that one is leaking urine. Pelvic floor physical therapy can be another one, using Kegel exercises, possibly even using a pessary. And then there's also surgical interventions that can be done. The next topic here is anal incontinence. So anal incontinence is when there's involuntary leaking of gas or stool. In some women, bowel control problems are often the result of childbirth or vaginal childbirth. And as the baby passes through the vagina, the muscles and tissues of the rectum may be stretched or torn. So then the anal sphincter can get injured during the vaginal delivery, and hence you can have anal incontinence. This is usually associated with more severe perineal lacerations. Some women have short-term bowel control problems right after childbirth that improve within a few days or weeks. And then other women do not develop a problem until later in life. So, and as a person ages, the sphincter actually weakens. So sometimes a problem that's actually pretty minor in a younger woman can actually worsen with age. Oftentimes, patients are reluctant to disclose these symptoms to their providers, so then it leads to not really diagnosing these issues appropriately. So it's really important to bring these up with your primary care or with your OBGYN provider if this has been something that's been going on, so that we can talk about treatment options. And that can include dietary changes, fiber supplementation, medications to decrease constipation and loose stools, again, pelvic floor physical therapy, or even surgical options. Hemorrhoids are swollen blood vessels in and around the anus and lower rectum. They can become painful, itchy, and irritated. Contributing factors include pregnancy, constipation, standing or sitting for long periods of time, or straining during physical labor. And so oftentimes these are one of the issues that arise during pregnancy and get worse after pregnancy. Treatment options include ice packs to reduce the swelling, witch hazel and tux. These are for when a patient has acute symptoms or flares, adding fiber and fluids to diet to really help have softer stools, and sitting in a bath of warm water can help relieve some of that pain. Hemorrhoid creams or suppositories can be prescribed as well. And then surgery may be needed to remove hemorrhoids in some cases. Oftentimes, surgeries for these hemorrhoids are done after the pregnancy period. Another important issue in the postpartum period is mental health issues. Oftentimes, there are already patients who have pre-existing conditions, such as a history of postpartum depression or an existing mental health issue, such as depression or anxiety. And these can be exacerbated during or after pregnancy. Patients are usually in talk therapy or seeing a psychologist or a psychiatrist, or they're already on medications. So it's really important to bring these up with your primary care provider or your primary OBGYN, since these things can be continued during pregnancy and during the postpartum period, and just so that we also can be aware of what other management options are needed. Postpartum blues are usually self-limited and resolve within 2 weeks. Postpartum depression may commonly start about 1 to 3 weeks after childbirth, but can occur up to 1 year after having a baby. So if some of these symptoms are still present, especially during that time period, it's really important to bring them up with your OBGYN. Contributing factors include changes in hormone levels, prior history of depression, emotional factors, fatigue, and lifestyle factors. Sometimes there are changes to dynamics in the home that can contribute or exacerbate depression symptoms, and it's important to bring that up with your provider. One of the great things we have here at St. Jude is our maternal mental health program, and they actually offer virtual appointments for our patients. This makes this resource very accessible to our patients. If medications are needed, they can also prescribe medications or connect them with a psychiatrist to see what other interventions are needed. Oftentimes we get the question or the concern of like, well, what if I'm breastfeeding? Can I still continue these medications, such as antidepressants or anti-anxiety medications? And that's a really important topic. You can talk to your OBGYN provider about that so that you're not limiting yourself from maybe medication that a patient needs and additional resources just because someone's desiring to continue breastfeeding. Another issue that comes up with a lot of our patients is postpartum weight retention. We all know the benefits of exercise, especially helping and strengthening and toning our abdominal muscles. Exercise can also help prevent postpartum depression. It also promotes better sleep and boost energy, can relieve stress. It can also help lose extra weight that you may have gained during pregnancy. So depending on what type of delivery a patient has had, whether it's vaginal or cesarean, or what other medical conditions they have, such as preeclampsia, poorly controlled type 2 diabetes, it's really important to discuss with our OBGYN when they can start to exercise after pregnancy. For health benefits, most guidelines recommend at least 30 minutes of exercise, at least 5 days a week. And so some of the important things to bring up with your primary OBGYN after delivery is to really ask, like, what types of exercise can I do? What types of exercises should be included, should be avoided, how often, the intensity, the difficulty, and basically how you're progressing that exercise regimen moving forward. Some of our patients also ask like, well, I'm at home, it's COVID. What can I do? Where can I seek resources to help me exercise at home? There's a bunch of post-pregnancy fitness classes and apps that are available online. And so I think that's one of the things that our patients are using so that they can work out at their own pace, their own schedule, and basically anywhere. It's obviously hard to have a newborn at home, but carving out this time to take care of yourself and really rejuvenate yourself after, whatever you've been doing at home is really important for not only your mental health, but also your physical well-being.
Okay, so now for some questions. I'm gonna answer one question that I commonly get in the office from patients. And one of those questions is, since vaginal delivery seems to be so damaging to the pelvic floor, should women just have C-sections up front? So the short answer to this is no, but the longer answer is that While cesarean delivery seems to be associated with a lower risk of pelvic floor disorders compared to a vaginal delivery, a C-section doesn't completely eliminate the risk of a future pelvic floor disorders. There are a lot of other factors that increase the risk of pelvic floor disorders, like Dr. Estrada mentioned earlier in the talk. And even if a reduction in pelvic floor disorders could be demonstrated, you would have to weigh that against the risk of C-sections, which include increased pain, longer recovery, risk of injury to other organs during surgery, increased risk in future pregnancies. So in general, overall, it is safer to have a vaginal delivery, even though it may have a slightly increased risk of pelvic floor disorders in the future.
I know this is a recorded situation here, but at least a couple of the questions that do get brought up at our clinics is, can these problems arise during pregnancy? And if so, do I have to wait until after delivery to get treatment? Absolutely not. So these things actually can arise, especially during pregnancy. And so it's really important to bring that up with your OBGYN provider so that we can talk about treatment options and also even refer you to maybe physical therapy or pelvic floor physical therapy to kind of mitigate these symptoms and also kind of help these symptoms from getting worse and not just addressing them after delivery. Other things that can, another question that comes up is, can anything be done to prevent these complications? So exercise during pregnancy can help prevent musculoskeletal problems and postpartum weight retention. This also has been shown to have a positive effect on mood disorders. So it's really important to kind of incorporate some type of exercise during pregnancy. Obviously, depending on how far you are in pregnancy, what your current medical conditions are, whether or not you have type 2 diabetes or preeclampsia. It's really important to talk to your provider what kind of exercises you can do. If there are placental disorders, that also limits the kind of exercises that can be done. However, oftentimes we can help modify these activities so that patients can still do some form of physical activity. So again, the best place to start is with your OBGYN provider.
Okay, well, thank you guys for coming to our talk today. We'll have our contact available if you guys want to reach out, and if you have any additional questions after the talk, we'll be happy to answer them.